Good morning, everyone. I am Sunil Sahai. I'm an associate professor of internal medicine at MD Anderson here in the clinic. And before I start talking, I have two issues with speaking. Number one, I tend to mumble. So if I don't say something that you understand, please stop me and raise your hand and ask a question. And number two, I tend to pick up my speed of speaking as I go through the talk. So I'm pretty much mumbling the end of the talk. So I try to keep cognizant of that fact. Sometimes I forget to. The title of my talk is Sing the Forest for the Trees, prostate cancer and healthy lifestyle. The reason I chose this is, like I said, I see patients who go to the operating room before surgery. And one of my jobs is, what medicines are you on? And a patient may be on one or two medicines like high blood pressure or cholesterol medications, but they're on 40 different supplements. And going through that is a nightmare for us because we don't know what these supplements do. And some of them do work, but my job is kind of give you a big overview. What can you do? Simple stuff, free stuff that doesn't cost hundreds of dollars off the internet to do to help you live longer. First of all, as you all know, America is getting older. In 1980, we only had about 11% of our population that was above 65. The 2050 projected is going to be close to 20% of the population will be over 65. And that's because the baby boomer generation and their kids are now entering that age where they're retiring. The unfortunate part is that America is getting sicker. If you look at what my clinic sees, and these are the patients with prostate cancer and bladder cancer, the urologic patients, out of 500 patients, over 300 had high blood pressure, another 100 plus had diabetes, another 100 plus had heart disease of some sort, and then coronary disease and lipids. So basically, when you come to MD Anderson, if you are a bladder cancer or a prostate cancer patient, more than likely you have multiple medical comorbidities or multiple medical illnesses, which are what I'm going to focus on today. And it's not just prostate cancer, but it's all types of cancer. As we get older, we get more diseases. Prostate cancer, the stuff you hear in the news, does medical illness make a difference? The question is, if you have diabetes and prostate cancer, you compare that to somebody who does not have diabetes and prostate cancer, who lives longer. Does diet make a difference? Now, this is what makes the news all the time and stuff on the internet. If you eat more fiber, you're going to live longer with that cancer. If you eat more pulses and legumes like nuts and beans, that will live longer. What kind of meat you eat, does that make a difference? Fat, does it make a difference? What kind of fat do you eat? Supplements, do they really make a difference? Does weight make a difference? If you're older, if you're fatter, does it make a difference? And also, does lifestyle make a difference? Those are questions that we really don't have a good answer to because it's very hard to do studies on these kind of questions. It's very easy to do a drug study when you give somebody drug A and give somebody else a placebo or drug B and compare the outcomes. But I can't remember what I had for breakfast yesterday, and you're supposed to do a food diary down for a whole several years worth of information. So the data trickles out, and it's not very clear sometimes what the data tells us. So kind of read the point. There is about a 15% lifetime risk of getting a prostate cancer diagnosis. However, there's a 3% risk of death. What that means is men who develop prostate cancer have a higher rate of dying with prostate cancer than of prostate cancer. So the way I put it in clinic is something else is going to kill you, not the prostate cancer for most patients. Fatal prostate cancer, the lethal variant, there is some association with diabetes. We don't know really what that means because when you run the numbers, it's not statistically significant. That means that there's a hint that there's something going on there, but we really can't prove with the math that it's something that we can really clearly say that this is an issue. Same thing with high blood pressure. Does having high blood pressure increase your chance of developing a fatal variant of prostate cancer? We think it may be true in African Americans, but we're not really sure because the data does not support itself out. Smoking, there's an association. If you are smoking at the time you develop prostate cancer, there's a chance of you having a fatal variant. And also there are some hints about obesity and weight. If you're fatter, and for a paradox, if you're taller, you may also have increased risk of developing prostate cancer. So the trials that come out, this is what makes the news. You know, you have trials that are done, people are given supplements, and they're seeing what is your chance of developing a type of cancer, a certain type of condition. Well, from the 2 trials that came out recently, we know selenium supplements reduce the risk and vitamin E reduce the risk. If you take those 2 supplements, you had a lower chance of developing lethal variant of prostate cancer. Same thing for beta-carotene, but paradoxically, it increased your risk of developing lung cancer. The SELECT trial came out a little bit afterwards and then says neither selenium or vitamin E work. So you're kind of stuck there. The only good trial that's out there, which my colleagues talk about, is a PCPT trial, which shows that finasteride actually will reduce the rate of developing cancer. However, those who do develop it having the lethal variant. So right now, you're totally confused. What do I do? What do I take? Do I take this pill? Do I take this supplement? What's being pushed on the news or the internet? You know, that's the question we have as physicians. What do we tell our patients? Well, I have a little bit of an easier job in the sense that I don't have to do the counseling for this, but I do recommend the healthy lifestyle stuff. And what I'm about to show you right now, everything I'm going to show you is completely free. There is no cost for you out of pocket. And for those of you who have internet access, I would recommend writing down these websites. They're in your they're in your handouts, so you can look at them at your own leisure. The American Heart Association. Everyone has heard about the American Heart Association. Stop smoking, live a healthy life. They actually came out about a year ago with something called Life Simple 7. 7 things that you can do to reduce your chance of developing an illness that will kill you and live longer. And I'll go through them one by one. The website is mylifecheck.heart.org. And the nice thing about this is that as you go through this website, you register with your email address, your number, and your password, basically. It keeps score of what you do. And you can go back in there as the months and years progress and see what your score does. And I will show you my scores, what I got on the scoring system. First thing, get active. That's the first question I ask my patients. What do you do on a regular basis to remain fit? Now, by definition, prostate cancer is a disease of older men. Older men who are past 65 tend to be retired, and those who are not working don't really have an excuse not to go for a 30-minute walk every single day, unless it's 200 degrees outside. But the recommendation they have is 150 minutes a week of moderate exercise. Basically, the question is, how do you define moderate exercise? Basically, you should be able to talk but not sing between breaths. Now, granted, for some of my patients, walking to the bathroom is moderate exercise, because that means you're really out of shape. But you should be able to walk the halls of MD Anderson. That's one of the questions I ask. My clinic's here in the main building, and the urology clinic's over in the Mays Clinic. And I always ask, did you walk or ride the golf cart over? Because that is one of the things we check on. A 30-minute walk, 5 days a week. It's not that hard to build into your schedule if you plan it that way. And it's not a 30-minute walk where you stop and ask every neighbor how the grandkids are doing. You know, you have to go nonstop at 100 steps a minute and go from there. Golf, mowing the lawn, the Wii Fit actually qualifies as moderate exercise, bicycling and swimming. Now, most of my patients who are retired, the men love it when I actually tell their wives they need to play golf more often. So it really, even riding the cart does really help, playing the game of golf. Or you can do 75 minutes of exercise a week, a vigorous. And that's basically, you can only say a few things between breaths. That's running, cycling, swimming, playing football, any exercise class, and lifting weights. I'm not sure about yoga, but everything else you can probably qualifies as vigorous exercise. So if you think about it, finding 75 minutes of your time out of a week really should not be that hard. Now, this is do as I say, not really as I do, because I can't find that time being a physician here at MD Anderson. But it is, we have to find the time to do it, and it really does what makes the difference in us overall. Control your cholesterol. I'm not going to ask a question, but everyone's heard of cholesterol. Everyone has heard of HDL, good cholesterol, and LDL, bad cholesterol. And a lot of my patients get it confused. A very good way of remembering it is HDL is H for high. You want your HDL to be as high as possible. LDL is bad. You want your LDL to be as low as possible. And the goals are 100 mg, the numbers are up there for you. 40, anything less than 40 is a risk factor, and less than 60 is protective. Now, one of the issues we have in internal medicine is that these ratios, while a person may have a very good total blood cholesterol, the ratios of the good and the bad may be off. For example, I can tell you in the Asian Indian population, which I am, Indian males have this problem. Indian males have very good total cholesterols, but our HDL, LDL ratios are off. We don't have enough good HDL. We have too much bad LDL. So Indian men in general are at a higher risk of developing heart disease and heart attacks than the average other person who has the same number, who doesn't have that ratio messed up. So it's very important that you can talk to your physician about what your particular risk factors are. There's also familial variants where these things are thrown off and you may need medication. Triglycerides are another component of the cholesterol panel. They're not cholesterol. They're different fat in your body that are required. The nice thing about triglycerides are that's the one that responds the best to exercise and diet. You can actually get your triglycerides checked and embark on a 1-month exercise program, and you can see a dramatic difference in the drop of those numbers. Next thing, eat better. We all need to eat better. Everyone in this audience is of the, yes, sir. That is a slightly controversial topic in medicine right now. Most physicians believe that you need both. You need, even if your number is too high, you still need medication and treatment, irregardless of what the ratios are. So first thing, you look at the total number first, and then you look at the ratios afterwards. So basically, if the total number is 300, 250, or even 240, you still need treatment, and then you worry about the ratios secondary. You are a generation where you remember the 4 food groups, right? Okay, that doesn't exist anymore. In 2005, the government came out with new guidelines which actually are better. The American Heart Association has these on their website, what we should be eating. 4 to 5 cups of vegetables, fruits and vegetables a day, fish, 2 servings a week, fiber-rich foods, not enough. You cut back on your sodium, cut back on your sugar beverages, increase the number of nuts and pulses you eat, avoid processed meats, and avoid saturated fat. Stuff you've been hearing about for years. The problem is that you hear about this, then you go to Denny's or you go to Pizza Hut and you pick out. I do, it's or start by kolache factoring the way in to give a lecture, So it's very hard to take this abstract concept and put it into words for what do I need to do? What does my family do? The basic message is you're going to use food as a source of nutrients rather than a dietary supplement. Now, if you remember, the 4 food groups got changed to the food pyramid. The food pyramid got changed recently to MyPyramid, and it's at the CDC website, MyPyramid.gov. Again, you go to the CDC website and you put in your particular risk factors, your age, your lifestyle, your man or a woman, whatever, and it will give you a little pyramid showing you how much grains you have to eat, how many vegetables, how many fruits, milks, meats, and beans. And the nice thing about this actually has variations for people who are sick, people who have diabetes, people who are of Hispanic origin, people who are African American. It will give you a breakdown for what you need to eat, and then it has links to a whole bunch of recipes. I'm not sure about government recipes for anything, but it will actually help you make that decision what you need to eat and how you can watch yourself. Next thing, lose weight. Now, these numbers probably don't mean a lot to you. The way we calculate who is overweight, who is obese, and morbidly obese is by a number called the BMI. The BMI is basically your weight divided by how tall you are. The BMI of 25 is higher, is considered overweight. Obesity's BMI of 30, morbid obesity's BMI of 35 or higher. In order to lose weight, you need 30 minutes exercise 5 days a week. And the basic concept behind losing weight is you need to expend more energy than you're taking in. If you cut out 500 calories a day out of your diet, and you have a negative net balance of 500 calories a day, and you will lose 3,500 calories in a week, 500 times 7. That is 1 pound of fat gone from your body. So people who can maintain that negative balance will do very well. Now, what does BMI mean? It's very hard to say. Now, I'm going to step out here. How many of you all think I'm fat? How many think I'm just right? I'm perfectly right.
You got to turn around.
Oh, okay, turn around? I'm going to call it outside thing. Okay? According to this calculation, I am this close to being obese. My BMI is 29.5. And my wife is really aware of that fact. So is my physician. But, you know, it's such, in America, for the women in the audience, you know, the old size 6 is a new size 2. You know, how they change the size of the dresses. The dress hasn't changed, but the number has changed. We now in the United States have a very warped view of what is considered to be fat and obese. And these numbers are based on Americans of all ethnicities and all stripes. It is not just like the old children's growth chart were Scandinavian kids in Minnesota for how tall your kid was. So Asian kids got screwed in that little process. But this growth chart is for everybody. It doesn't matter who you are. Now, the question I always get back is, well, you know, I'm 300 pounds, but I'm a linebacker. How many of you have ever seen a fit retired linebacker? All that 300 pounds of muscle mass gets turned into fat. And that's one of the issues we have. Next thing, manage your blood pressure. Normal blood pressure, everyone's heard 120/80. That actually is a fallacy. A normal blood pressure is 110/70 or anything. And in my world, it doesn't matter how low your numbers are. I've heard my blood pressure is too low. There's no such thing as a low blood pressure until you faint. Marathon runners average a 90/40 or 90/30, and they're perfectly fit. Now, for some people, 90/40 would make them faint. But if you are consistently running in the 120 to 140 range on that top number, you are considered pre-hypertensive. And you need to start making changes in your lifestyle. Anything higher than that gets medication. Next thing, reduce blood sugar, insulin resistance, and pre-diabetes. Everyone's heard of diabetes. What the problem is the pre-diabetic state. That is brought on by obesity, being inactive, having high blood pressure, and having a cholesterol problem. In the United States right now, 20 million people have diabetes, of which 6 million don't know they have diabetes. The big number is this 57 million. 57 million, America's population is 300 million. 1 in 5 people don't know they're pre-diabetic. And the majority, I just spoke in the audience, the majority of people in this audience are over 60. 1 in 5 of you in this room are pre-diabetic. And you probably don't know it. The risk, why is diabetes so bad? Diabetes has a higher heart disease death rate, almost 4 times, stroke rate almost 4 times. It is the single leading cause for blindness in this country. It is a single leading cause for kidney failure. It is a single leading cause of neuropathy, dental disease, and amputations. But the good news is that if you are pre-diabetic and you just make lifestyle changes, not talking about medications, just lifestyle changes, you can drop your rate of developing diabetes by 60%. And if you're over 60, it's a 70% drop. And those lifestyle changes are eat right and exercise more. The very last thing was stopping smoking. Smoking is still the single most important cause of preventable death in the United States. It accounts for 500,000 deaths a year, and of which 135 are due to heart disease. If you stop smoking, the benefits are within a month. They last a lifetime. So I'll tell you my score. My score is 7.4 on this, and the ideal is a 10. So I'm actually in the green zone, but not really there. My blood cholesterol is perfect. I'm married to a vegetarian, so that really helped. Blood pressure needs improvement. I'm in the 120 range for my blood pressure. My blood sugars are pretty good. I'd never smoked. My diet does need improvement, and I need to control my weight. I need to become more active. So by putting your numbers in, you get a number, and you can have at least some idea of where you need to focus your entire lifestyle. Another website is called realage.com. Now, this website, one of the issues is that there's a whole bunch of advertisements down the side trying to sell you stuff, but you can do the basics for free. What it does, it asks you about 30 questions about your health, your habits, your relationships, your diet, and your fitness level, and then it calculates your real age, not your chronological age. So when I put my stuff in there, my real age is 35. I'm actually 39. So, it makes me, so for the women who celebrate, my wife who celebrates the 8th anniversary of her 27th birthday, she really may be 27 in real age. It is something you guys can look at your own leisure. I would highly recommend it because it actually gives you individual breakdowns of what you need to do to help live longer. To kind of summarize everything based on the current data, the recommended diet for prevention and management of prostate cancer comprises a diet low in fat, high in vegetables and fruits, and avoiding high energy intake. Basically avoiding more energy you take in than put out, excessive meat, and high dairy products. What basically the American Heart Association website and the government is telling you. So in conclusion, the doctor of the future will give no medicine, but instead will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. I like this quote not because of what it says, but about who said it. Thomas Edison in 1903. We're not there yet, but hopefully we'll be at some point. Thank you very much.